if you're the average person, you're walking around with 15 to 20% less water in your body than your body actually wants to have, what's your body going to do? How's it going to deal with that? Let me ask you a more pointed question. Blood is 92% water. Do you think your body's going to make 15 to 20% less blood because that's all the water there is? What do you think? How well are you going to do with 15 to 20% less blood? My guess is your virtually infinitely intelligent body knows that blood, it's kind of important, right? Just a tiny bit important, okay? It knows that your heart, lungs, liver, kidneys, brain, pancreas, thyroid all need to have the water they need to function, or you become an ex-person. Okay, those are vital organs. You have to have what you need. So what's the body going to do under those circumstances? It's going to take the water from non-vital places. Like what? What's non-vital? Where could you lose water and still survive and function? Skin. Where else? Eyes. Exactly. Where else?
Lymphatic fluid.
Discs, right? Lymphatic fluid's pretty important, okay? If you don't remove the waste, it's just like blood, okay? It's a vital thing. If you don't remove that waste from the cells, your cells quickly die. Okay, I don't think it's taking it from the lymphatic system. But we have skin, eyes, discs, where else?
Joints.
Joints, absolutely. Let's look at some of those things, okay? Eyes, skin may be a little less obvious, but your eyes are balls of jelly. What do you think that jelly's made of? It's over 90% water, okay? A few years ago, I spoke in Scottsdale, Arizona. Anyone know Scottsdale? Scottsdale is a affluent retirement community. I spoke at a vegan restaurant there. I had 50 people there, and there were maybe 3 people that weren't 60 or older. Everyone was over 60. Okay? I asked them, how many of you over 60? They raised their hands. I said, how many of you over 60 don't wear glasses, contacts, or haven't had laser surgery? No one raised their hand. Every single person there had corrected vision. That's typical, over 60. Most people lose their vision as they get older. And there's a number of different conditions that occur. But there's one that's the most common. Anyone know what it's called? It's called macular degeneration. With macular degeneration, what's happening is the eye is deforming. Okay, it's no longer the right shape. Why do you think that happens? I think it happens because the body is purposely taking water away from the eye, and it's losing its shape. Okay? Let's talk about discs. Your discs are bags of water. They're there to cushion your vertebra. If you're dehydrated every single day of your life, your body's looking for places to take water from. It might be taking them from your discs. And this, I believe, is why the average person over 60 or 65 has lost a significant amount of height. Okay? This is why so many people have degenerative disc problems. This, I believe, is why. Okay? Joints. Let's look at a hip joint. Your hip's a pretty intense thing. You're carrying all your weight on your legs, and your hip is a ball. It's a ball and socket. So your leg has a ball, the hip is a socket, and you can move your leg, assuming you've got all the cartilage you need, you can move it almost 360. How does that work? How is that possible? Bone on bone is incredibly painful. Cartilage there, which is made almost entirely of water, allows one bone to glide over the other. Okay? That's how it works. That's how all of our joints work. We need this connective tissue to allow these things to move. Okay, people have their hips replaced because there's no more cartilage. And there's no more cartilage because there isn't enough water to maintain it. That's why it breaks down. It's dehydration. And skin's no different. Okay? It's no different. Some of you have heard the story. I apologize. I'm going to repeat myself. About not quite a year ago, we were closed. Peter and I were here. I got an email from a woman who said, I'm visiting. I'm a fan of yours. I watch your videos. I'm in Costa Rica. Would it be possible to come by and visit with you? I said, yeah, sure. I said, come for lunch. So we arranged a date. She shows up. We sit down to eat lunch together, watermelon. And she says, can I have a bowl to spit the fiber into? I'm like, what do you mean? It's like, well, I only swallow the juice. I said, why? She said, well, my body doesn't want anything besides the moisture anymore, so it's hard for me to swallow. She said, I think it's because I'm so well hydrated. I said, that doesn't make any sense. And honestly, when she showed up, I thought, oh, what a nice little old lady. I'm looking at this woman going, yeah, she must be around 75, right? I was 56 at the time. I was shocked when she told me that she was a month older than me. 1 month. Okay? Why did she look so much older? What do you think? What was I seeing? Tons of wrinkles on her face, sagging skin here. She had a low-cut top on, sagging skin here, arms and legs that were all, sagging, all this loose skin. Now, by the way, I hear from raw vegans all the time, fruitarians who tell me, no, I don't drink any water. I don't need to, because I eat high water content fruit. Without exception, those people who come here eating high water content fruit and not drinking water have been the most dehydrated people we've ever measured. This woman said to me, 31 years on high water content fruit. I don't drink water. I dry fast. I said, I can see that. It shows. Okay? I took her blood pressure. You guys know about spread. Took her blood pressure. I'm saying to her, you're not getting anywhere close to enough water. You don't have enough blood in your body. Okay? And she didn't believe me. I said, if you'd like, we can put you on the scale and actually measure your hydration level. So the average person we see here is around 68% water, should be closer to 80, lean tissue. Hers was 63%. We measure very few people that low. Okay? Not a healthy thing. Okay? This is what's going on. Okay? You can see wrinkles on the face are evidence of long-term chronic dehydration. And we've had people who've been in their 60s and older get them hydrated, clean out their body, get them hydrated, and what happens? The wrinkles disappear. Okay? They disappear. Now, you can use expensive creams and treatments, etc., to try to change that from the outside, but you're not affecting the underlying condition. You're not changing. You might look better, but you're not changing the underlying condition. Most people my age, especially with my level of body fat, which is pretty low, 6-7%, are going to have a lot more wrinkles on their face than I do at 57. The difference is I'm well hydrated and most of them are not. Okay? All these things can be changed. Every one of these things can change. How do you do that? Well, the first step is you've got to get all the garbage out of the body. Because until you get all the garbage out of the body, your body's trying to get all the garbage out. And eliminating garbage through any of the 5 primary channels, colon, urinary tract, skin, breath, and mucous membranes, each of those channels requires water. Everything's moving on water. Not enough water, nothing's moving. Okay? But you're going to keep losing water as the body attempts to move this stuff. You have to get all the old stuff out of the digestive tract. Okay? Now again, those people who've been with me before, and we've polled them before, have all said, Kusel, Andy, Peter, Benjamin, yep, you eliminated a bunch of old hard stuff. It happens to every single person. Okay? You guys are going to eliminate a bunch of old, hard material. And it only happens if you rest enough and sip enough water. You go fast as somewhere else, I'm not going to mention any names, but places like in California maybe that rhyme with things like moo morph, I'm not going to name names, they're going to tell you, drink when you're thirsty. 3-4 glasses a day is average, and no one eliminates old material. And they leave there getting some benefits of fasting, but not getting all the benefits of fasting, because their body's not clean yet. that old stuff is going to sit there like a sponge absorbing water, and you're never going to get the water you need. Get your body clean, and you can get almost all the water you need by simply eating properly. Once your body's clean. Until you do that, it's never going to happen.